Hello, in today's video, we will understand what COVID-19 pandemic is and how it has influenced the world, especially India, as currently it is the worst affected country. So, let's begin. Today, it has been more than 17 months since the novel coronavirus or SARS-CoV-2 caused a massive outbreak of respiratory disease, which is commonly known as COVID 19 and pneumonia in Wuhan, a city in China. Since then, it has affected almost all the countries around the globe and sickening millions of people. With every passing day, there is a new learning for doctors about this virus, its symptoms, and effects. Let's discuss the symptoms. The most common symptoms of COVID 19 are fever, cough, and shortness of breath. However, as the disease is spreading like fire, some noticeable and unusual symptoms have been recorded, like loss of smell and decreased sense of taste. According to a report, extreme fatigue, sudden drop in platelet count can also be a sign of this deadly disease. Doctors are recommending to isolate themselves and consult their healthcare provider if anyone notices such symptoms. It primarily spreads through respiratory droplets or through air. When an infected person sneezes or coughs, the virus can travel from one person to another either directly or via an intermediate surface. In fact, if researchers to be believed, virus can live up to 24 hours on cardboard and 2 to 3 days on plastic and stainless steel. There are a few myths doing the rounds around this COVID 19 disease. Let's discuss those. Myth number one is if someone is tested negative, they do not have the infection. Wrong. In most of the cases, COVID 19 tests do not provide 100% results with accuracy. In fact, only 70% of COVID 19 patients may find the results positive. Therefore, if you have any symptoms or have been exposed to the virus and have tested negative, you must still take all the necessary precautions to avoid its spread. It takes 5 to 7 days for the test to become positive after an exposure. Myth number 2 is while exercising, one should cover the face or wear mask. No, wearing mask when doing exercise or any kind of workout can have fatal effect on the health as it will cut down the passage to breathe freely. Another important factor is while you do exercise, due to excessive sweating, mask will also get wet and it will thereby double the chances of growth of microorganisms causing this infection. And lastly, summers or high temperature can kill the virus and give protection. Contrary to belief, exposing yourself to the sun or temperatures above 25 degrees will not protect you from coronavirus. It has spread in countries which have extreme hot weather conditions and caused havoc. Now, let's discuss its impact on India. In India, there is almost 14 times rise in new cases since February 2021, and the curve is increasing with every passing day. It has been predicted that the second wave of coronavirus pandemic in India is likely to peak in mid-May or early June, and it will have direct impact on the economy. The curve of COVID 19 cases and mobility trends will have a direct bearing on the level of economic activity and steep decline in employment index. India's GDP went down by 24.4% in the quarter ending June 2020. As per ICRA, an Indian rating agency, an earlier availability of vaccine imports, enabling a faster coverage of vaccination drive, may offer a back-ended upside to the GDP growth in financial year 2022. Another most important and devastating impact is on individuals' mental health, which is turning out to be more lethal, infecting more people and taking more lives. The uncertainty about their present and future, government mandates to stay at home, distant from their loved ones, lack of social support, and fear about new variants is all worsening mental illness. According to mental health experts, since the beginning of April 2021, there has been a rise in telepsychiatric consultations by at least 20%. The most prominent problem reported by people is anxiety and depression. Teens are more stressed out about their future plans, resulting in this massive crisis, while the adults are overwhelmed by the fear of survival, financial insecurity, and job security. So, what are the cures? As new COVID-19 symptoms are not detected in the early stage or a lot of people are asymptomatic, health officials have advised all people who are socially active and coming in touch with outside people to immediately limit their social contact to prevent the spread. Wearing a cloth or N95 face mask while going to a public place will protect others. Washing hands, using sanitizer, maintaining social distance of at least 6 feet or 2 meters, fully sanitizing products purchased from outside, avoid touching your eyes, mouth, and nose are few other measures people can take as precaution. And most importantly, stay motivated. That's all for today. Thank you for watching. We will meet again in another video with some other facts, custom, and people.